So craniosynostosis is an interesting disorder that involves the growth of the separate bones of a baby's skull. It's a very dynamic area. The bones of the skull are actually designed, we think, to help a baby get through the birth canal. So the bones are actually flexible. Any of us that have seen newborn babies, we see sort of odd shapes. But after the baby is born, the separate joints, or what we call sutures between those bones, are not important. That is, until one of them misbehaves. And when these sutures or joints misbehave, it causes a premature fusion between two or more of these bones, and that then causes a growth abnormality of the skull. The truth is, we don't really know. This is something that seems to be seen more often, diagnosed more often, and there are different forms. There are certainly forms that are genetic. These are forms that have names to them, like Apert syndrome or Pfeiffer syndrome, and there are many of them. But the vast majority that we see, probably 90%, have no apparent genetic cause. They're not syndromes. They don't exist with other findings. They're just simply isolated to the bones of the baby's skull, but if left untreated, can lead to some serious problems. It's amazing that in my lifetime that's really changed, and I think now we believe that this occurs in at least 1 in 2,000 babies. So if you think of a room with 2,000 babies, it doesn't seem that common. However, if you spend some time in my office or here at NYU, you think it's a very common disorder. And as it's out there, more physicians become aware, and certainly more parents become aware, we're finding that the diagnosis is getting picked up much more reliably. So I believe the incidence is probably creeping up over the years. The ones that you would see on the internet, we're always afraid to have parents go to the internet without some guidance because, as you've pointed out, they can be frightening. But many of the babies that we're talking about are milder forms, and what we're seeing sometimes on the internet are those that are simply not picked up at all, and left untreated, they do get to be much more severe. Well, they can really get very severe, and these can be problems that, as you would guess, if the skull bones are not being allowed to grow normally, the growing brain underneath is not being allowed to grow normally. And in the normal situation, the bones of the skull are actually pushed to grow by the growing brain. And in the case of craniosynostosis, the table is turned and the bones are actually dictating to the brain how to grow. And so one advantage that these babies have is that the bones are very thin, and so any pressure at all of the growing brain on those bones will allow it to grow in other areas. Even though the synostosis may be restricting growth in one area, the brain can still get growth in other areas. But the downside of that is that the deformities can actually become worse because of it. As the baby grows, again, if not treated, the bones gradually become thicker and it becomes harder for the brain to push. And then we start to see some of the bad effects of this. Those can be problems with the brain and intellectual development, developmental delays, can be problems with hearing, vision, and in severe cases, even breathing. So it's important for us to get these diagnosed properly early so that we can determine a reasonable treatment plan and get things underway at the right time.